Hello, thank you for joining us for a question and answer session with Dr. Nancy Holsapple, the Indiana Director of Special Education. This parent Zoom meeting was sponsored by the Indiana Resource Center for Autism and the Autism Society of Indiana. The Zoom meeting is hosted by Dr. Kathy Pratt, Director of the Indiana Resource Center for Autism. This meeting was recorded on July 27, 2020. The question and answer session begins with the first question, which is about students with disabilities who are not able to wear a mask at school.
Disabilities, that option that they could wear in school. But if your child falls under those guidelines put into the executive order, you could just reiterate that if your school says, your child is 9 years old and needs to wear a mask. You can share with the school, you can ask for a case conference, but the school should know your child and whether or not that mask would be a challenge. I have seen some things that I think will be helpful. Like the teacher has a button, the sports, there's different kinds, they have the pen, but it is an actual picture of the teacher. So the children can see what the teacher looks like without the mask on. And then I've also seen that says, I cannot wear a mask. This is like a button. I have sensory issues. Thank you for maintaining social distancing. So that is like a button that children can also wear if they cannot wear the mask, as long as they would try to implement social distancing. I raised 2 kids, and I know it's going to be a struggle because kids are touchy kids, they show their affection often by hands-on, and trying to implement all of these social distancing guidelines will be difficult for a lot of our children. So,
thank you, Nancy. I'm going to ask questions about therapy. I know what I've heard from parents is a concern about how will my child receive speech therapy, OT, sensory therapy, physical therapy. How will that be handled if virtual education continues? Or if on-site, how will that be handled?
So if the families decide that they want to do virtual, or like Washington Township schools, they are starting virtually. So what they would do is continue with the teletherapy online for families if the child was receiving OT, PT, or speech. If the school is open and children can go on site, I know one of the things that I've heard many schools are doing for the speech therapists, besides the clear shield, is they're purchasing the plexiglass. They're calling them like sneeze guards, but it would allow the child not to wear a mask, nor the speech therapist, because they have that barrier between them, and they could have the instruction at that time. The one thing that may change, so parents, if a school contacts you, don't be surprised, because of the social distancing. If your child had been in group, say of groups of 3 to 4, the school may contact you and say, due to social distancing, our groups are going from 3 to 4 to maybe 2, because then they could have your child with another peer, but yet have the opportunity to have that space in between for the safety of both children and the therapist. I've had questions from parents just in emails asking about the therapy. If they choose not to do virtual, could they have packets or instruction? And, of course, the answer is yes. If the physical therapy would send home exercises, or it should be applied toward the goals that are in the IEP. So if a child's working on fine motor skill or large gross motor skills, then the parents, if they have that opportunity to implement those themselves, they could get the instruction from the therapies. But schools still have to provide the related services that is in a child's IEP. What we're used to may just look a little different. So when school starts, your child would continue with those services. It just may look different. And I think it's going to look different because they are going to try to implement, safe practices, social distancing, and trying to, they advise about hands-on, but it's difficult if you're working with a child on range of motion or showing them how to do a pencil grip to not be able to touch them. So just expect the schools to say it may just look a little different.
And I think, Nancy, one of the things that we know about the state of Indiana is that school districts go under local control. So it's really hard for any of us to say this is what every school is going to do. You really have to go back to your district. And, we've just seen changes occurring even in the Indianapolis area with how schools are choosing to join together or not. So one of the things I have to tell you, as I've talked to parents, some parents have told me that their children have done really well through the virtual learning, and others whose children have really struggled with it. Some of our kids, especially those more significant needs, oftentimes are not going to learn the best using Zoom or worksheets. Tell me the kinds of suggestions or supports that DOE is offering for those families, or ideas that you would have for those situations.
So my department is still working on more guidance to apply and provide to schools, because it is, like you said, ever changing, and it is, oftentimes educators have to think outside the box. So if we have a child with significant disabilities and they don't do well virtually, yet they're now going to do pencil paper task, then what can the schools do to reach the families, to reach the children in the homes? I have heard of different things that schools are trying to develop. It's almost like a sensory kit type thing that they could send home to the children to use. If the parent can log into Zoom or to the virtual classroom and have the teacher talking with the student and not having the student, enter data or anything into the computer, but doing the interaction virtually as they would in a classroom, but maybe give them materials ahead of time on what they're going to do. The challenge becomes if the child is not able to participate virtually and not pencil paper, getting the materials in the home, and then making sure if the parents are the ones implementing the task that they understand what the expectations are, because the goal is that whatever's in a child's IEP, the school continues working toward those goals. And sometimes it's it's not sometimes, it is the families and the schools working together. And I have had conversations with parents who, when the pandemic first hit, you may have two essential workers in your home. And because, school is a typical 8 to 3, 3:30 kind of day, well, that may be the same hours that they are working outside of the home. So if it's something that, the school has to work with the family on when the instruction is done, everybody has to be compassionate and understanding in this situation, because it's going to take both sides working together, because the outcome should be our kids are getting an education.
And Nancy, you support a network of resource centers around the state of Indiana too that IRCA is involved with as well, and we'll be looking for answers. And for the parents on here, just so that you know, in almost every school district in Indiana, there is an autism leader who we work with, we support. And as we've been meeting with the autism leaders, many of them have like wonderful, amazing ideas, and they care deeply about the children as well. So the other question that I've had, or concern that I've heard, is about the assessment process and 3-year evals. I know parents of children who think that their child may have an autism diagnosis are concerned about how will there be an evaluation process that my child can go through in schools now. And if my child is in school and they are up for a 3-year evaluation, how will that occur now?
Sure. The federal government Congress is the only one that can change IDEA. And right now, they have not done any waivers except on the timeline for first steps to Part B. And that was Betsy DeVos making the recommendation to Congress. But the timelines, the schools have to follow the 50-day timeline. If it's a reeval, you have that year time frame. But when the COVID hit, and I was talking with school psychologists, their biggest challenge was they had not been trained to conduct evaluations virtually. And ethically, they were having concerns because, one, their test protocols, their test kits were not designed to conduct evaluations virtually. So once school starts back, if your school reaches out to you to say, we need to finish the evaluation on Nancy, so we need to have your child here on such and such date, then in order for your child to get that evaluation, you need to work with the school and making sure your child is there on the day that the school psych would complete the evaluation. The 3-year reeval, you have that time frame to gather the data. Kids have not been in school for almost 5 months, and there is a concern of lost skills. So when school starts back, and if your child goes on site, then we have to give them time to get acclimated back to school. And then the schools are going to look at skill level and continue pushing, for the children to achieve. So the only choice on the evaluation is you bring your child in that sense. Pieces that can be done if it's a checklist or social history, if that information's sent home to the families to complete and sent back to the schools, there's that avenue. But there are certain pieces of that evaluation that may be done in the school setting. The only other thing is if a parent rescinds their signature, their permission to do the evaluation, but parents need to make sure they understand that stops the timeline. And then if you wanted your child, say in the spring to be tested, you would have to sign a new evaluation. But right now it is, if we're looking at completing the initial evaluation, it's my understanding from the school psychs, when I've had conversations with them, they really need that child on site to be able to complete that.
I know there's been some conversation about if the ADOS can be completed, remotely. And what we're hearing in terms of the research is that it really can't be. So I know that's going to be a concern.
Right.
So I'm just going to rip the Band-Aid off this one. As I've talked to families around the country, there's been a concern about compensatory education. And I think such a concern for so many families about their children losing ground on things, if they're going to lose skills or they're going to miss out on important education. And I know, Nancy, we've talked about it in terms of recovery education. Mm-hmm. And, I think I would hope that kids are resilient and that whatever loss there is, we can make up for, but I don't know what your thoughts are about it.
And when I say, you know, a loss, it's not just with students with disabilities, because I look at all kids, and kids are kids first, and every child learns differently. So if they have not had the ability to access, if they're doing virtually, or what they've done in this past 5 months, then yes, there could be a loss in the skills. So when we talk recovery versus compensatory, compensatory is usually used when we say the school is at, I don't want to say at fault, but say they had a denial of FAPE, for an example, or failed to implement the IEP as it was written, say for accommodations on a test assessment or something along that line. Then those could be viewed as compensatory services. But because all schools in Indiana had to shutter their doors, and when it all went virtually, e-learning was for every child, not just certain children. So when we start looking at our kids, we're saying, what can we recover? What skills do they have that we could build upon, and then work toward recovering those lost skills, and having that child try to gain as much as possible. There will be situations where if a parent files a complaint and my department reviews the IEP and they find that the school did fail to provide FAPE or implement, or whatever the case may be, then that complaint investigator can recommend in the results of the hearing or investigation of the complaint to have compensatory services. But keep in mind, if that happens and your child is participating virtually for education, to even get the compensatory services, you know, might be even a challenge too, because if a child's on a computer 7 hours a day, and then you are entitled to so many hours of compensatory services, that's additional hours online. And for some children that may be perfectly fine, but for a lot of kids, they just need that brain break and to step away from the screen. So we do know there's going to be cases where schools are going to have to provide compensatory services. But as the Office of Special Education, we're looking at recovery services. And that's really how we're approaching this, because all kids had to go to e-learning.
So Nancy, you know, parents, and as we heard before this session started, parents have a tough decision to make about, you know, sending their child to school or choosing to have them do virtual learning. And, you know, I say, you know, I think about it in terms of what's a reasonable risk, you know, and, you know, hopefully the numbers will start coming down with people wearing masks and such, but it is a tough decision. And I worry about the decision not only for our students, but also for our teachers as well. So I know that some families are thinking about possibly just pulling their child out and doing homeschooling. What does that mean then in terms of the IEP if your child is pulled out and just homeschooled?
Sure. So if you decide as a parent that you're going to homeschool your child, you would need to contact the school, and you would tell them, you know, I have made the decision, I'm going to homeschool. The school would have a case conference, and they would offer you a service plan, because in Indiana, homeschool is considered private school in Indiana. So the schools would offer you a service plan. And in that service plan, you would get some services, but you would not get the services that you would in an IEP. If you as a parent say, I don't even want the service plan, then what you're saying is you're rejecting services from the public school. And then your child would come out of the system in the sense that you would not receive any related services or any educational services from the school. The curriculum, the instruction, all of that would fall on the parents. It's the intent from the state that if a parent decides to homeschool, they actually register with the state in the sense of they get a homeschool registration, but not all families do that, and it's very difficult sometimes to track. So if you decided to do that and you decline any services from school, then say in a year or two, the COVID virus, we've got a vaccination, numbers have gone down, we don't have to wear masks anymore, you decide to send your child back to school. Well, that IEP will be void. So as Article 7 states, you need to have a new evaluation. Your child would have to go through the process. They would be in school without services until a new evaluation is done and an IEP is developed. So, and I do know, I've had conversations even this past weekend with some family members who were talking about possibly homeschooling. And I said, there's a difference between homeschooling and the virtual learning. One, you have to be able as a parent to provide the education to the child because you are going to be the total educator in that sense. Whereas if your child is doing virtual learning, yes, you're supporting the child, but the curriculum, the assignments, everything comes from the school.
Thank you, Nancy. Talk to me a little bit about how case conferences are being handled or will be handled probably this year.
Sure. So when the schools shuttered, and even those who are starting virtually, you can still participate in your case conference by the virtual case conference. You can participate by phone, or if your school is open and you're able to go on site. I will tell you that in having conversations with a lot of schools, they are limiting the number of adults who come into the school. One of my colleagues today was saying that when she went to enroll her two girls, she got a notice that you have to do a drop-off line, and the child's temperature has to be taken once they get out of the car. If they have a temperature, then they cannot go on campus. They have to get back in the car and go home with mom or dad or caregiver. But those are things that those are ways you can participate in a case conference. We were able to work with our IEP vendor in the spring to do Ed Plan Connect because a lot of families have access where they can sign the IEP, they can get it through an email, and then virtually sign it, and it goes back to the student electronic file. So that was another way that we were able to work with families. We are continuing the Ed Plan Connect. So if you decide to not send your child on site, or even if you do, and you have a case conference coming up and the school has your email, then you can get an electronic copy of your child's IEP, proposed IEP, and it's being translated into the 12 languages that we currently translate the IEPs into.
So Nancy, you talked about visitors in buildings, and I know that at least with the autism leaders that I've spoken to, I think many districts are working with their state board or their county board of health to try to figure all this out. And so I know that visitors are not probably going to be allowed in buildings, and that means consultants like me, and it also means ABA therapists coming into buildings for those individuals who received ABA therapy. Is that
Right.
an accurate assessment?
That is correct. I have heard some schools that have consultants, such as you, Kathy, are going to try to have this done virtually.
Mhm.
But yes, the schools are truly limiting the number of people, just trying to keep the students safe and their teachers safe.
Mhm. Okay. So, some of our students have issues around toilet training and behavior. And, I've heard from both parents and educators is, it's going to be hard with social distancing and with other strategies sometimes to address some of the self-care and some of the behavioral issues of students. Do you have any guidance or suggestions on that?
We have discussed the bathroom concerns, and not only the toiletry, but if students have that are tube fed and have to have casts done during the day, then what's in that child's IEP. Now, the school may ask for you to have a case conference, and they may try to brainstorm with you on how they can best do that safely. It could be something where, if the nurse's assistant or the nurse or the health aide or instructional assistant who are helping with that child, they may wear, which I'm sure they would anyway, they may have the gloves on or they may have a gown on. So if situations like that occur, that's what you need to find out from the school. So then you can start talking with your child. So if you have a child that has anxiety and needs to talk through or have a social story done, then you have that time to prepare your child to let them know. So, when you get your catheterization, this is where you're going to go, this is who's going to assist you, and this is what they may be wearing. So those are things that parents need to be having conversations with the schools prior to the school starting. So if you feel like you have a lot of unanswered questions, then you need to be reaching out to your teacher, to your school, and asking for a case conference if they can't do it on site right now, but are willing to do a virtual. At least you start that conversation and you have an idea of what's going to happen. The same thing, we've had conversations with around kids who have behavioral issues, because we have kids who bite, kids who spit, those types of things. And if a child is able to wear the mask, well, then that would help, on the elimination of biting and spitting, because they're not going to have access to do those. But if it's a child who cannot wear the mask for the reasons that I listed earlier, then you would have that conversation with your school on what they can do as a team to try to meet the needs of your child. The COVID came into our lives, but that didn't mean our lives as we knew it prior, on behaviors, on children. Those things didn't change. How we approach school, how we approach the situations, those have all changed, because today I was talking pre-COVID and then COVID, because life as we knew it prior to COVID, yes, we always have had concerns sometimes with schools and making sure, our kids are being educated to the best extent possible. That's always an ongoing conversation. But then you throw the COVID in there with the pandemic and all of these suggested guidelines, it just, escalates certain problems that it's going to take a team. And when I say team, I mean parents and schools working together to try to figure out how the kids can be educated.
And Nancy, I have to tell you that I really appreciate the fact that you reached out to people to try to figure this out, because there is no playbook for this. We've never been through this before. I was just with, I've kind of inherited a Greek family, and I was with a Greek family member who is 97, and her mother's first husband died in the 1918 Spanish flu, and it was interesting talking to her about that. We haven't had it for over 100 years, so it's a real different time.
Right.
So
Right.
up in the chat box, there is information from Christy Laughlin about a book that's on the ASI and ASA website that talks about how to transition your child with autism back to school and or work, and it's free for families. My staff have also created a lot of materials as well to help families with that transition back to school and to help their child via social stories and visual supports and such. But Nancy, when you think about parents preparing their child to come back into school in whatever the form that may be, what would be the guidance you would give to families to help prepare their child for this shift?
If the parents decide they're going to have their child go on site, this is what I would do if my kids were younger, and I knew they were going back to school. I would have them start wearing a mask if they can, if they're able to do that, and increasing the time that they're wearing the mask. I would definitely make sure that they are doing the hand washing correctly. If it's singing the ABC song or whatever, count to 20 seconds in your head or out loud, whatever works best for the child, practicing those. Something that when I've been out, I have noticed, wherever you go, Walmart, Kroger, any place has arrows and directions on the floor. I would make sure if my children were with me that they see the signs, the arrows, and discuss that with them and make sure they're following that line of traffic, that flow of traffic. I would make sure they understood that when they go to school, their school supplies are theirs and they can't share them. If it's something as you get a box of crayons and you take fingernail polish, a bright color that a child might like, and put a dab on each crayon, and you share with that child that you can only use crayons that have this color, this dot on the crayon. You can't use any others. Sometimes kids just are visual learners and do things more visually. So if it's something as simple as marking their supplies, then the child knows I can't use anybody else's because these are my things. Kids sneeze. Another thing I've seen besides, when they sneeze, make sure if they have individual packets of tissues, whatever the case. I have been seeing lanyards. So if your school allows your child to have a lanyard, then you clip the end onto the mask, because then when the child takes the mask off, say at lunch, instead of laying it down or dropping it or whatever, it's attached to that lanyard. When they get done eating, the mask goes right back on, and it's not touched on anything. Or I anticipate a child taking the mask off and swinging it, or doing the flipping at kids, because kids are kids. It doesn't matter their age, they are going to do things. So those would be things that I would start planning and preparing. Kathy, you mentioned the social stories. I think that would be great. I would be putting those things in place. I would be discussing with my child expectations. Before, you could use a water fountain. You can't do that now. So here's your water bottle, and put their name on it or however you're going to mark it, and say, this is yours that you're going to drink out for the day. And, have your child, if you have to go buy a new water bottle, have them go with you. And if they like Marvels or Fortnite or whatever kids are into, try to find something that they are interested in and they're going to use it. I've heard on lunches, breakfast may be grab and go. And then I've also heard that if children take their lunches, that they have to take them in paper bags or disposable stuff, so they're not carrying the lunch bags back and forth. So you need to check with your school to see what the guidelines are going to be on that, because you don't want to send your child to school on the first day with a new lunch bucket and then find out they're not even supposed to take those. So those are all different things that you know, I would be researching. If you go to your school's website, they may have a lot of that re-entry information already up. Um, I think in PE, what I've read in the executive order, if a child is participating in physical ed, not recess, but the class of physical ed, that they're supposed to wear the mask unless they're doing something that is exerting. And then recess, they're supposedly to be with their class at recess, and at that time they do not have to wear the mask while they're playing. If it's a rainy day and they're in their classroom and they're having recess, then probably they will have to wear their mask if they're able to wear a mask. Talk through with them that their classroom setting may look different, that there may not be things that they can put their hands on like they've always done, just for the mere fact that it would be difficult to try to keep those things clean, disinfected. So limited toys may be in the classroom, limited hands-on things. If your child comes home from school and says that after I got done playing with the puzzle, Mrs. Smith took the wipes and wiped everything down, just have that expectation that that's what they're supposed to be doing. Same thing with playground equipment. Anything that kids are interacting with, after the uses of it, they're supposed to be cleaned. If your child is in a wheelchair or uses a walker or a scooter, if you have one specific for your child and not the ones that the schools provide, you know, those things will be disinfected. If you utilize the ones that are offered by the school, just know that those will be disinfected, especially the handles or the part of the wheelchair or the scooter that multiple people may touch, if it's a brake or, like I said, the handles. So don't think that if it's on something that your child is utilizing, that they're focusing on your child. No, that's what they're supposed to be doing. They're trying to eliminate the germs and reduce the risk. My office just put out some more guidance on that exact same thing. Same thing with assistive technology. If your child uses a communication device, just know that the school will probably be disinfecting it. They'll wipe it down with the wipes, or if they have a special spray solution, that will be occurring. Because the goal is, if the kids are on site, they want to try and keep that school as sterile and clean as possible. Because if they have to quarantine, then that's a 14-day quarantine. So, and we
So
don't want that to happen.
Nancy, there's a couple of questions on the chat that I want to refer to, and if I don't reflect, if I don't speak these correctly, if the person who wrote these wants to speak up. First one's from Deanna, and I think we answered part of it about the mask requirements for little kids in preschool. But she says, I have two autistic, almost 3-year-olds starting developmental preschool in hopefully September. What will the schedules look like for developmental preschool? She lives in Westfield.
You mentioned this earlier, that, you know, it's local control, and each school will be doing things that best meets the needs of their community and their kids. So I have heard that preschool will start. It may start a little later than the typical school age kids are starting, but know that what they're doing in the classroom, they may not have as many motor skills, fine and gross, toys, the whole hands-on activities that typically 3 to 5 year olds, that's how they engage, that's how they learn best. And they may not have as many of those opportunities. They'll have them, and I'm sure the school will be disinfecting after the uses. But once you do your case conference, if you haven't had your initial case conference, you will be having that once you enroll your kids in the preschool. Then you can have those conversations. It could be that the children in the preschool, if they're 3-year-olds, they may go Monday, Wednesday. And then they may have 4-year-olds go Tuesday and Thursday, and then 5-year-olds go Friday. You know, it's all dependent on the number of kids that they have and what they can do to try to help with social distancing. I know when I have been in preschools, they're usually high numbers because they try to have the peers in there as well. And to try to social distance 3 to 5-year-olds, and you've got 20 to 22, you know, of that age group, it's going to be a challenge to do, because to me, they're just, you know, they just got out of the baby stage. I know they're a little older than that, but you know, they are still learning. That's for them. That's how they interact. That's how they express themselves, is typically by their behavior. So it would be difficult to, you know, put so many things in place for that age of a child to say you can't, you can't, you can't, when, you know, our goal is to educate them and try to expand their knowledge. So when your school reaches out to you, you know, if they can offer it however many days, or if it's mornings or afternoons, you know, you just have to have that conversation with the school, because we do have some preschools that are pretty large, pretty large numbers of kids.
So Nancy, there's a question from KT, and I'm going to read this. My child's teacher sent out an email that says, due to social distancing, most activities will be performed individually and seat work time will be significantly increased for safety purposes. And to another person, the teacher wondered if our child would do well and thought maybe we should continue with a day service program. Can you give ideas on how FATE can be implemented under COVID guidelines?
Well, one, on the seat work, whatever the teacher is sharing with you, they have to provide the services that, one, is in your child's IEP and to the fullest extent possible. And the goal is to always have the child in the gen ed class as much as possible. If the child can successfully do 80% of the time in gen ed, or 100%, or 20%, it's dependent on what the child can do. If the teacher is saying there may be more increased seat time and less group projects, that's probably how they're trying to address the social distancing. Instead of doing group, it may just be more individualized. And as long as all kids are being provided that opportunity and not just kids with disabilities, then there's no denial of FATE, because it's the same for everybody. On the day school, you know, that's a case conference committee's decision. If the child is being successful in the day treatment school and the parents are in agreement, and that's what the case conference committee decides that's the best avenue for the child, then yes, that's what you need to decide. But if it's not, and you feel like your child's ready to acclimate into public school and you want to pull them out of the day treatment, then you would have a case conference. The IEP would reflect that they're going to public school. If they're split between gen ed and special ed time, that would be reflected in the IEP, but it would be dependent on the child. Now, just remember, if a child is in the day treatment program and has been there for a while, and they come out and they go into public school, um, just remember that everything's a little fluid, as I keep saying, because our goal is we're going to keep our doors open and our kids have the opportunity to come to school. But because we don't have enough knowledge about this virus and everything I keep hearing and reading, whether it's true news or fake news, they're saying that there's possibly another wave that's coming in the fall, that it could very well be that we have to shutter our doors again if the numbers increase so much that it's not safe, or if there's a school in a county that the health department has grave concerns about. And I know a lot of the schools are talking with their health departments on what's the best plan. But if the health department comes back and says our numbers have increased so much that their recommendation is that that county, they may shutter their school, school would continue virtually, but they may close the school. Nobody knows what is going to happen with this virus. The goal would be that a vaccine is found, and of course, with any vaccine, you've got to have time. You've got to have the vaccine given. To me, you have to see if it works, and this is all a time frame. It's not, we've got the vaccine, everybody gets it, and we have a quick turnaround. I'm not a scientist, so I couldn't even imagine, but common sense would say this is going to take a minute for us to figure this out. So if you feel like your child is best suited for public school, then have that case conference and say, I want my child in public school. He or she did very well in day treatment school, and this is our step down. This is the least restrictive placement, and this is what we're going to look at.
So Katie also asked, are there any state guidelines for the virtual option? I've heard that in our county, there is a single person for all students with IEPs, and there are over 1,000. My child didn't do well with the remote learning in the spring, but I'm leery about sending them back. I don't want them to infect others because of their needs and in terms of some drooling and stuff. But it doesn't sound like the virtual academy our corporation is doing will be very helpful. So are there any kind of standards for the virtual schools?
I have heard, we had virtual schools prior to COVID, and a lot of families withdrew their child from the public school they were attending for various reasons and enrolled them in the virtual schools. So those schools have been doing virtual training, virtual learning for some time. The public schools who were doing on-site, the COVID hit, and they went to e-learning, virtual. Those teachers had to take all of their lesson plans and convert everything that they had known into virtual. Did schools do as well as they had hoped? Probably not. Did they try to do what they felt like was the best they could? Yes. When I've had conversations with educators, when e-learning was first developed, it was for inclement weather. And you would think, oh, we're going to have a snow day or two. That's okay. We can throw the lessons online, that type of stuff. Nobody anticipated months. So, it was kind of like lesson learned. They realized what they needed to do. I think many of educators spent their summer in professional development on how they can better become, if need be, virtual teachers. It's my understanding from reading a lot of the re-entry guidelines that schools have on their website. Some have employed teachers just for virtual, and some have employed like an elementary virtual teacher and a middle school, high school virtual teacher. So those people are kind of tracking, working with the kids who are doing virtual, making sure they're getting their assignments, if they need check-in, that type of stuff. And then I've read where the smaller districts are employing just one person to do virtual K-12, if that's the case. I think a lot of the schools are doing what they can with what they have. Um, the cost of the preventive, the masks were provided by the Department of Education and the health department. Schools had to complete a survey to say how many students they had in their district, but the hand sanitizer, the extra mask, the gloves, the gowns, if they went that route, those things, if it didn't come out of the CARES money that schools were entitled to by the federal government, then it came out of their state, their general fund. So what would have been spent on maybe something for the classroom or a field trip or extracurricular, that money may have been earmarked now for these preventive measures. I think it's going to be interesting, because when you look at your very small districts, Kathy, to your very large districts, you know, your large districts have more revenue, and they are possibly able to offer more than your small districts. I'm not saying that, you know, the small districts still can't do a good job, because they can. It just may not look the same as a large district. And there again, you know, it's going to have to be a parent's comfort level on if they're going to send their child back to school or if they're going to choose to do virtual.
So we know that, Nancy, that our schools are pretty poorly funded in the state, and I know that this is just putting a major stress on schools, you know, having to, with the accommodations that they're needing to make. I think that I've asked all the questions. Deanna, also, they're in first steps right now. They age out at 3 years of age, and the next step is developmental preschool district with district therapists. Is that correct?
Mm-hmm.
Yeah, you're correct, Deanna. So Nancy, I want to, there are questions coming through about compensatory education, FAPE, a free appropriate public education. And basically, and tell me if I'm wrong, because, you know, I'm not the attorney in this, but FAPE is violated if what's available for students, in this case, every student in every district was out, whether they had a disability or not. So that wasn't really a violation of FAPE, because everybody was playing by the same rules. Okay.
Right.
So there's questions about compensatory services provided after school hours. And basically those are just giving kids more time during more services during the school hours, or it could be even in the future summer school hours, I would imagine. Right. Is that right?
Or, right. And, you know, I've seen a mix of how compensatory services have been provided. You're right. Maybe their day is extended. Maybe they get services over break, summer school, or I've even seen they'll start 2 weeks prior to school starting. Now we know that's all kind of a wash with this year because dates keep changing, but those are all different ways that I have seen compensatory services be provided. Making up time, speech services, instead of twice a week, maybe they throw in a third time and they're trying to get it in while they're in school. And it's really difficult because, like Kathy said, you know, when this happened, it was across the board. But if a school just says, we cannot provide services to you, then that is a denial of FAPE. Now, if families say, we don't want services right now, we've got so much going on in our home that we you know, we have too many stressors, and our mental health is what we have to focus on right now, then that's not a denial of fate, because the school offered all of that to the families. The families are the ones who chose not to take it. But if a school says, no, you know, I don't have any way to educate your child, then yes, there, that would entail compensatory services. I just saw in the chat box asking about recovery services. So what the recovery services would be across the board. Um, Kids, if you have a child in 3rd grade, they may be getting additional work, or they may have different formative or summative assessments being done to see what the skill levels are of the kids. Some kids may not have lost anything. You know, if you have kids who are avid readers or are always engaged in stuff, then, you know, it's a ongoing learning process for some kids. But then you have some kids who need that mental break. So when summer hit, they knew it was summer. So they're like, my school year's done. So there was no education being provided or trying to get the kids to participate in that sense. So those are kids that, you know, the school may say, hey, let's see where you're at on your reading level. Let's look at your goals in your IEP, on your language skills. Did you lose anything? If not, then let's move forward. If we see slight slippage in the skill levels, then that teacher would say, okay, we're going to pick up where we were in the spring, and we're going to add that, plus we're going to keep moving forward. So if the child has the ability, and when I say that, I mean, you know, we don't want to overload our kids either. So if they have that ability to process and keep learning new skills, then that's what the schools are going to do for the kids, for recovery.
Thank you, Nancy. You know, we started out with me saying that the 2 words were going to be flexibility and grace, you know, and I think that those have become my mantra words as we're thinking about the coming school year and the months ahead, because who knows when this is going to end. And I really want to thank you for giving up your evening to share some information with family members. I also know that you're very accessible to families as well. And within your office, you have Lisa Paddock, who is from InSource, who is part of DOE as well. And so families should feel free to reach out.
Yes. Okay. You can find my email on our office's special ed webpage. Sometimes, you know, it's questions specific to the district. So I want you to know that if I get a question and I kind of go, huh, you know, I've picked up the phone or I emailed the director straight out saying, I had a parent reach out to me and this is what they're sharing. Tell me, you know, fill me in on this story. And, you know, we'll have that conversation, because sometimes the special ed directors don't even know what may be going on in the buildings or what's possibly being said in a case conference. But I'm pretty good about, once I get an email, I try to give it 24 hours to get a response back out. And if it's a question that I can't answer specific, then I find someone within my department or within the division that can answer those questions. So, you know, our goal is to provide services to our families, and that's our job, to make sure our kids are being educated. So
thank you so much, Nancy. And for all the families, and I know we've got some educators on here, thank you all for your time today. And, you know, the Autism Society of Indiana and the Indiana Resource Center for Autism, as well as DOE, we're all here for you. Just feel free to reach out. Thank you all for your time.
thank you, Kathy.
Thank
Thank you, everyone.